Hi, everyone, and welcome to this presentation on transitions from expansion Medicaid to Medicare. Let's begin with the learning objectives. At the end of this presentation, you will be able to review Medicare coverage and enrollment basics, review Medicare and Medicaid basics, identify types of Medicare assistance programs, and understand how to transition from expansion Medicaid to Medicare. So there are a few topics that we'll need to be familiar with before diving into the meat of this presentation, and the first is Medicare basics. So what is Medicare? It is a federal program that provides health insurance for those 65 and older, those under 65 receiving Social Security Disability Insurance, SSDI, for a certain amount of time, and those under 65 with kidney failure requiring dialysis or transplant. And one thing I want to note here is that Medicare has no income requirements. We will be talking later about Medicaid, which has a very similar name. Medicaid does have income requirements, but Medicare, for people 65 and older, has no income requirements. There are two ways to receive your Medicare benefits. One way is through Original Medicare, the traditional program offered directly through the federal government. And the second way is Medicare Advantage, which are private plans that contract with the federal government to provide Medicare benefits. Medicare benefits are administered in three parts. We have Part A, which refers to the hospital or inpatient benefits, Part B, which are the doctor outpatient benefits, and Part D, which is the prescription drug benefit. The reason it's helpful to know about these different parts of Medicare is because you access them in different ways, depending on the type of Medicare coverage you have. So, more specifically, Original Medicare includes Part A, the hospital insurance, and Part B, the medical insurance. If you need prescription drug coverage, you can get it through what's known as a standalone Part D plan or a standalone prescription drug plan. That's how you would get your Part D benefits. Medicare Advantage, also called Part C, is a way to get Parts A, B, and D benefits through one private plan, like an HMO or a PPO. And again, Medicare Advantage plans are administered by private insurance companies that contract with the federal government. They're not a separate benefit, though. Everyone with Medicare Advantage still has Medicare. Their benefits are just being administered in a slightly different way. We'll move on now to talk a little bit about Medicare enrollment, as it's important to be familiar with Medicare enrollment rules when we're talking about transitioning from expansion Medicaid into Medicare. So one way you can enroll in Medicare is through being automatically enrolled. You will be automatically enrolled in Medicare Parts A and B and be mailed a Medicare card if you have enrolled to receive Social Security benefits before you turn 65, you have a disability and have been receiving Social Security Disability Insurance, SSDI, for at least 24 months, or if you are getting SSDI because you have ALS. People with ALS are automatically enrolled in Medicare the first month that they receive SSDI benefits. They don't have that 24-month waiting period. If you are not automatically enrolled in Medicare, you can enroll during three different enrollment periods. We have the initial enrollment period, the Part B special enrollment period, and the general enrollment period. The initial enrollment period is a 7-month period, including the 3 months before, the month of, and 3 months following your 65th birthday. When your coverage starts depends on when during your IEP you enroll. So we usually recommend enrolling in the 3 months before you turn 65 because then your Medicare benefits will start on the first of your birthday month. If you enroll during your birthday month or in the 3 months after, your Medicare start date is delayed by a couple of months. And so to avoid gaps in coverage, it's best to enroll 3 months before you turn 65. If you miss your initial enrollment period, you still may be able to enroll in Medicare if you qualify for the Part B special enrollment period, or Part B SEP. The Part B SEP starts when you have coverage from current work, also called job-based insurance, and you are in your first month of eligibility for Part B. It ends 8 months after you lose coverage from current employment because employment or insurance ends. Using the Part B SEP also means that you will not have a Part B late enrollment penalty. It's important to note that you're only entitled to use the Part B special enrollment period if you have coverage from current employment. You do not qualify to use the Part B special enrollment period based on retiree coverage or COBRA. Retiree coverage and COBRA are not considered by Medicare to be insurance based on current work. If you miss your initial enrollment period and you don't qualify for a Part B special enrollment period, then you likely have to enroll in Medicare during the General Enrollment Period, or GEP. The GEP is January 1st through March 31st of each year, and your coverage does not start until July 1st of that year. It's important to know that you may have to pay a 10% Part B premium penalty for the rest of your life for every year you delay enrollment when you use the general enrollment period. For example, if you delay Medicare enrollment for 2 years, then your Part B premium will be 20% higher. So that was a little bit about some Medicare basics, enrollment basics. We'll now review some Medicare cost assistance programs that are also important to know about in order to understand expansion Medicaid transitions. First, we have Medicare Savings Programs, or MSPs. MSPs provide help with Medicare costs. They pay for the Part B premium, and depending on the program, they may provide assistance with the Part A premium, if applicable, and other out-of-pocket costs like co-pays or co-insurances. Eligibility is determined at the state level, and rules vary significantly among states. For example, states can count income differently. Some states have higher income limits. States can have different asset limits, and some states do not count assets at all. Here on this slide, we have the baseline federal income and asset limits. Most states use these limits, but some states have different guidelines. So if you are looking at this slide and the income limits here, the income and asset limits, and you think you might be around these limits, we recommend contacting your state health insurance assistance program, or SHIP, to learn more about the MSP in your state. And at the end of this presentation, we'll go over how you can find the contact information for your SHIP. The second cost assistance program I want to talk about is called Extra Help. And Extra Help is a federal program that helps pay deductibles, premiums, co-pays, and co-insurances for Medicare Part D, which, as we learned, is the Medicare prescription drug benefit. If you have Extra Help, you pay no premium or a very low premium, and you pay low co-payments for your Part D covered drugs. Here on this slide, we have the federal income and asset limits for 2021. Extra Help is a federal program. It's run through the Social Security Administration, and these are the income and asset limits that count throughout the country. So I'll leave these up for a moment, and again, if you think you might be eligible for Extra Help, you can contact your state health insurance assistance program for help applying, or you can call the Social Security Administration. So one last core piece of information that I'd like to go over before we move into the transition process is just talking a little bit about Medicaid. So Medicaid is a federal program administered by states. It provides health insurance for individuals who have limited income and assets and are in one of these eligibility categories. They're either 65 years or older, have certain disabilities, are blind, need long-term care, are in a medically needy category, or are former foster care youth. Medicaid does not have a monthly premium, and you may pay a small deductible or copayment for your care. You can have Medicare and Medicaid at the same time, and people who have both of these benefits are known as dual eligibles. When you are enrolled in both programs, Medicare pays first for your health care, and Medicaid pays after all other insurance has paid. You should see providers who accept both Medicare and Medicaid so that you have the lowest or no out-of-pocket costs. Most people with Medicare have what's known as traditional Medicaid, which is also called Medicaid for the aged, blind, and disabled, or ABD Medicaid. It's important to note this term traditional Medicaid or ABD Medicaid because it's sort of in contrast to the other type of Medicaid we'll be talking about on the next slide, which is expansion Medicaid. So in this section, we'll be talking about expansion Medicaid. Again, it's sort of a different type of Medicaid than the traditional ABD Medicaid that people with Medicare generally qualify for. So under the Affordable Care Act, some states expanded Medicaid income limits and categories of people who can receive Medicaid benefits. Expansion Medicaid covers individuals with incomes below 138% of the federal poverty level who are childless adults aged 19 to 64, pregnant, children up to the age of 19 or 21 depending on the state, and parent and caretaker relatives. In short, expansion Medicaid is for people who in the past were generally not eligible for Medicaid. Expansion Medicaid is different from traditional ABD Medicaid that we reviewed in the last section. One thing that sort of sets expansion Medicaid apart from other types of Medicaid is the financial eligibility guidelines. For expansion Medicaid, your eligibility is based on your modified adjusted gross income, or MAGI. You'll also hear this type of Medicaid called MAGI Medicaid. So MAGI is your taxable income, and if you do not file taxes, then the eligibility rules match those for tax filers to the maximum extent possible. Spouses, parents, step-parents, and children living together are included in the same household. There's also certain income that's not counted towards your income to qualify for expansion Medicaid. That includes veterans benefits, workers' compensation, and child support. Resources and assets are also not counted. And it's important to note here as well that the income limit for expansion Medicaid is higher than the income limit for traditional Medicaid. So you enroll in expansion Medicaid through the state or federal health insurance marketplace. And marketplaces are forums where uninsured or underinsured individuals and also businesses can shop for health coverage. Your marketplace may be also known as an exchange or by a state-specific name. Some states created their own marketplace, whereas others use the federal marketplace. And the reason we bring up the marketplace here is one, because that's the forum you go through to get expansion Medicaid, and also because the marketplace may be involved in your transition from expansion Medicaid to Medicare. So now that we have covered Medicare and Medicaid and the types of assistance programs you might qualify when you have Medicare, we'll talk about the transition from expansion Medicaid to Medicare. So first, for a little bit of background, it's important to note that when you become eligible for Medicare, you are usually no longer eligible for expansion Medicaid. You should be evaluated to see if you are eligible for traditional Medicaid and a Medicare Savings Program, MSP. The agencies involved in this transition will depend on the state, but usually your local Medicaid office and marketplace should be involved. Here's a general overview of how the transition process works. First, you have expansion Medicaid, and you become eligible for Medicare. You may then be evaluated for traditional Medicaid as soon as you are Medicare eligible. Next, you are evaluated for traditional Medicaid. The timing and agency involved depend on state-specific rules. For example, you may be evaluated for traditional Medicaid at your expansion Medicaid renewal date. You should receive a notice about being evaluated for traditional Medicaid. This notice may come from the marketplace, local Medicaid office, or other agency. So as you're aging into Medicare, becoming eligible for Medicare, it's recommended to be on the lookout for any mail that looks like it's from an official source. You should also contact the agency that sent you the notice or notices and ask if there's any additional paperwork needed. Once you fill out any needed paperwork, your case should be transferred to the proper state agency for evaluation and processing. Note that you may be able to receive state reimbursement for your Medicare Part B premium while you transition. Rules vary by state, so contact your marketplace or local Medicaid agency to learn more. Regardless of your evaluation status, when you have expansion Medicaid and you become Medicare eligible, you should enroll in Medicare Parts A and B when you're first eligible. This is important because Medicare pays primary and Medicaid pays secondary, and you'll need Medicare in order to have primary coverage. If you do not enroll in Medicare when you're first eligible, you may also have a late enrollment penalty for having delayed enrollment. As for Part D enrollment, you may automatically receive extra help, which enrolls you in Medicare Part D. If you're not automatically enrolled in extra help, you can apply through the Social Security Administration, also called SSA. So once your state agency has evaluated your eligibility for various programs, there are a few different outcomes. One transition outcome is you will have Medicare with traditional Medicaid and a Medicare savings program. This will happen if your income is below the traditional Medicaid income limit in your state. Medicaid income and asset limits in your state. In this situation, Medicare pays first on claims and Medicaid pays second. And services not covered by Medicare may be covered by Medicaid. The Medicare Savings Program will pay for your Part B premium, and depending on the type of MSP, you may not have to pay your Part A premium, if applicable, or Medicare cost sharing. A second transition outcome is you will have Medicare with a Medicare Savings Program and without traditional Medicaid. This will be the outcome if your income is above the Medicaid income limit in your state, but below the MSP income limit in your state. In this situation, you will not have Medicaid as your secondary insurance, and you may lose coverage for services that only Medicaid covers, depending on the state, like certain vision and dental care. However, with the Medicare Savings Program, the MSP pays your Part B premium, and depending on the type of MSP, you may not have to pay the Part A premium, if applicable, or Medicare cost sharing. A third transition outcome is to have Medicare without traditional Medicaid and without a Medicare Savings Program. This happens if your income is above the Medicaid and the MSP limits in your state. In this instance, Medicare may be your only insurance, and this means that you're responsible for paying the Part B premium and other Medicare cost sharing. You may lose coverage for services that only Medicaid covers, depending on the state, like certain vision and dental care. In this situation, you may want to consider a Medicare Advantage plan that includes some coverage for dental and/or vision services, if those are benefits you're used to receiving or need to receive. And another option is to consider supplemental coverage that would help with cost sharing. A fourth and less common outcome is to receive Medicare and remain in expansion Medicaid. If you are a parent or caretaker relative, you may be able to stay in expansion Medicaid with Medicare as primary insurance. If you are in this situation, you should contact your marketplace or local Medicaid office to learn more. So those past couple of slides were about how the transition process generally works. However, during COVID-19, there have been some changes. During the COVID-19 public health emergency, you should be continuously enrolled in expansion Medicaid, even after becoming eligible for Medicare. So generally what this might look like is you stay enrolled in expansion Medicaid even after you turn 65 or become eligible for Medicare due to disability. To learn more about what this means for you in your state, we recommend contacting your health insurance marketplace for more information. Even if your expansion Medicaid is continuing, you should still enroll in Medicare when you're first eligible because Medicare is your primary insurance, and then your expansion Medicaid will pay secondary. That concludes this portion of the presentation, so now let's review what you learned. First, we talked about how, outside of the public health emergency, people with expansion Medicaid will transition to Medicare, possibly with traditional Medicaid and/or an MSP, when they become Medicare eligible. Your state or federal marketplace should typically be involved in the transition, and you should receive notices about being evaluated for traditional Medicaid. There are 4 possible transition outcomes to going from expansion Medicaid to Medicare. One is Medicare with traditional Medicaid and the MSP. A second is Medicare with the Medicare Savings Program, but not with traditional Medicaid. A third is Medicare without traditional Medicaid and without the MSP, so just Medicare. And the fourth, for parent or caretaker relatives only, is Medicare and keeping expansion Medicaid. We also noted that during the public health emergency, expansion Medicaid cases are being continued past when you become Medicare eligible. If you want individualized counseling and assistance with your Medicare choices and coverage, you should contact your state health insurance assistance program or SHIP. You can visit shiphelp.org to find your local SHIP.